A heart attack. It can happen to anyone at any time.
You're having chest pain?
It can present as crushing chest pain or left arm pain, or it can be as vague as experiencing unexplained shortness of breath or fatigue. Whether you survive the heart attack or not, and what quality of life you will have if you do survive, all depends on how quickly you can receive emergency care.
Rutherford County EMS, what is your emergency?
We're at the courthouse and my husband is having chest pain.
He's having chest pain?
That emergency care starts with the 911 phone call and continues all the way from the call to the cardiac cath lab for percutaneous cardiac intervention, also known as balloon angiography, where the artery is opened.
One, that's affirmative. 318 from Bay.
Your 911 phone call goes into an emergency dispatch center where trained personnel answer your call.
40-year-old male there complaining of chest pain.
The 911 operator will determine the nature of your emergency and send appropriate emergency personnel, such as first responders, the fire department, and emergency medical technicians and paramedics.
It's almost like a competition now for us. We want to get fast times. We want to make sure that we're not spending an inordinate amount of time on the scene. We want to make sure that we're not that we're recognizing those 12 leads that need to be treated very quickly. And so our guys, anything that we can do to help the patient and help the recovery is what we want to do.
Once we're dispatched and requested by EMS, we will arrive on the scene. Once on the scene, we're going to assess the patient. We're going to gather sample information for the paramedics to arrive, and we will gather their medications, and that is basically when a patient is somewhat stable. Additionally, we always carry O2 when we can administer oxygen and take vitals. We have a medical form that we'll fill out and tear off a carbon copy and give to the paramedics once they arrive and pass over patient information, and then we can, at that point, we are there for assistance to the paramedics. They assume all medical.
These specially trained persons will evaluate your condition, do a 12-lead ECG, administer medication, and determine if you're having a heart attack. Once they determine you are having a heart attack, they will either transmit the ECG to the emergency department or call the emergency department with their report of your condition, or some services can do both. This early notification of the emergency department staff and physician allows them to be prepared for your arrival. It also allows them to call the cardiologist and cath lab staff to get prepared. And this happens before you even arrive at the hospital.
We can make a diagnosis from the EKG on the patient who is still in the back of the ambulance being brought to the hospital. And with that information, we can activate the cath lab and get them ready and let the cardiologist know that they're coming, and move people very quickly from the door up into the cath lab to have their arteries opened when they're having a heart attack.
Once you arrive at the emergency department and have been seen by the emergency department physician, the cardiologist will do his evaluation and prepare you to go to the cath lab for your catheterization.
Causing your chest pain right now.
From the time they roll into our door to the time they get up here, we want to do it as fast as possible. For an emergency department, for us, 20 to 30 minutes to the cath lab is a reasonable goal for us. More importantly, from the door to an EKG interpretation of 10 minutes or sooner if they're coming from our field services with ambulance patients.
Trained emergency department staff will transport you to the cath lab and assist the cath lab staff in getting you ready for your procedure. You will be placed on a special X-ray table and prepared for the catheterization procedure. Special medications are administered and special equipment is prepared and ready for the cardiologist. When the cardiologist arrives, he will administer dye through a special catheter into your heart arteries and can tell which cardiac arteries are blocked. If appropriate, he can use a balloon to actually do away with the blockage in your heart. Your muscle is saved. In the cardiac medical world, the saying goes, time is muscle. The time from the onset of chest discomfort to the 911 call to the hospital cath lab. This means the longer the time before the blockage can be opened and the heart muscle receives blood and oxygen, the more the heart muscle dies. The shorter the time before the blockage is opened, the more the heart muscle lives. That's why each step of the way, each member of the chest pain team is trained and drills to improve the response time of each step and is vital in the chain of care, because time is muscle.